Thank you so much for your time, Dr. Doig. If we can get an introduction, who you are and your position in the School of Nursing.
My name is Dr. Alexa Doig, and I am a professor and the director of the School of Nursing here at NMSU. I have been a nurse for about 27 years, and I've been teaching for over 20 years. So for most of my teaching career, the only thing I've ever taught is pathophysiology, and I love that course, and probably will never give up teaching that course, because for me it really becomes a foundation for nursing practice. It helps you understand what's going on with your patient when they have a certain diagnosis, how to focus in a health assessment, a physical assessment, ask the right questions, understand the medications that we're administering, the medical treatments that the patient's undergoing, and really being able to help the patient or client understand what's going on in their body, and being able to describe that to them is very powerful. And so that to me is why I teach that course, and for the most part of my career that's the only course I've ever taught. Here at NMSU, our undergraduate pathophysiology course has between 60 students and over 100. It depends on the semester. So I was always interested in medicine and healthcare, but ended up instead doing a degree in mechanical engineering on my first degree at university. I grew up outside of Montreal in Canada, in the province of Quebec, and I was there. That's where I did my engineering degree. I left shortly after graduating and came down to the United States, and actually my first venture in the United States was doing a rock climbing trip. One of my favorite things to do is to be outdoors and go camping. And so every weekend, or whenever my husband and I and our dogs can get away, we pack up our little teardrop trailer and we hook it up and we go somewhere. And that's the beauty about living in southern New Mexico. There's so many great areas here. And so for me, that's where I can really relax and, forget about everything else and just really enjoy being out in our beautiful, beautiful surroundings.
Yeah.
The way I got into nursing is I met a certified nurse midwife, and she was providing care for a good friend of mine. And just seeing how she worked with her clients was something I really hadn't seen before, and it was something that really drew me in. And so as soon as I had that experience, I was able to be at the birth with my friend and the certified nurse midwife. I kind of decided that I needed to become a nurse, and at the time I was thinking I'd become a nurse midwife. It was a long road to get to nursing. I had to do a number of prerequisite courses and figure out where I was going to go to nursing school, but I made the decision to go to the University of Utah in Salt Lake City, and kind of started my career over again. And so even though I didn't end up going into women's health or nurse midwifery, it really kind of started there.
Yeah.
When you're in a nursing program, you're primarily exposed to hospital-based nursing, and there is so many opportunities within that environment, but there's also many other opportunities outside of the hospital setting. So I always encourage nurses who are maybe getting a little bit of burnt out in their current job, or feel like they're getting burned out, about the nursing profession and being a nurse, is to really explore what other options there are within nursing. There's so much. There, of course, is community-based nursing and clinic-based nursing, but there's even things that are not as clinically focused, working for a pharmaceutical company or another kind of technology company as well too. So there's really a lot of opportunity, and even outside of the field of nursing itself, nursing really prepares you to do so many things. But the first thing to do is maybe just try a different area, field, a different setting, a different facility, different organization, thinking about, we have governmental organizations that hire nurses, our Department of Health, really lots and lots of opportunities.
Yeah.
So when I was in my BSN program, when I ended up going through my labor and delivery nursing rotation, I kind of had second thoughts about becoming a nurse midwife. However, I really didn't know what I was going to do. I ended up really, really enjoying my psychiatric nursing rotation and really thought about that as a career and as a path. And then I also really enjoyed being in the intensive care unit at our Veterans Hospital. And so that was definitely high on the list. In the end, because I was still Canadian at the time, I couldn't be hired at the VA. And so I started looking around I really didn't know what I was going to do as a nurse when I graduated. So what I committed to myself was to interview for every position that looked interesting to me. And I ended up working in oncology and cancer nursing. And the reason I ended up in that area was because I interviewed with a nurse manager who just made an incredible impression on me. She had a vision for nursing that I had really never seen before, and a vision for her nurses, just the highest level of professionalism. And I decided that that's where I wanted to be. That's the kind of person I wanted to work for. So I ended up coming into nursing because of nurse midwifery, but then ending up, my clinical area was in cancer nursing, and I just loved that. So before I became a nurse, actually when I was doing my nursing prerequisite courses, I had to go back and retake anatomy and physiology, and I was lucky enough to be in an anatomy course that had a large human cadaver lab, and staffing that lab were undergraduate students, undergraduate teaching assistants, and I loved that course so much, and I loved the topic, and I was really interested in getting into teaching, so I joined that teaching team, and I taught in that lab throughout my whole nursing program and even into the graduate program. So anatomy was kind of how I got into teaching, and I taught anatomy both at an undergraduate level in this human cadaver lab at the University of Utah and at the University of Utah's physician assistant program. I taught anatomy, physiology, and hematology there for over 20 years. So I think overall my most rewarding experience in teaching is when I have a student in a class, or maybe students in a class who are really struggling with the content, maybe for a variety of reasons. And then, working with them over the course of the semester and then seeing them get it, where this switch turns on and all of a sudden they get it and they understand how to learn, how to study, how to remember things, how to take tests, and when that light turns on, that to me has always been the most rewarding experience. I can picture multiple students across my career, who I still remember because of the hard work that they put in, and being able to see them succeed after having struggled so hard.